The following are signs of abnormal menses. In case you have one or maybe several of them in combination, you need to see your gynae so that they get to see exactly what's going on. The first one is when you have those menstruation clouds which are larger than a grape, or they usually happen every now and then. So they're not supposed to be frequent and they're not supposed to be large. So they're supposed to be there in between. If this is the second one, if you usually feel dizzy, you feel very tired, or you have frequent headaches, or you have that brain fog during when you're getting the menses, or maybe immediately after your menses, this might be an underlying condition, and you can corroborate whether you have an issue by going to any hospital with a laboratory where they can be able to test for your HB. This one will tell you the quality of the red blood cells that you have. In case they are lower, we are talking about ladies here, in case they are lower than or below 12.5, then this is a condition that should be checked, because now this is anemia. Number 3, if you usually have cycles shorter than 21 days or they are longer than 35 days, then you need to have that checked out, because might be there's something underlying. And also during this, we are still talking about this point here, in case maybe you usually get let's say every time you usually get your cycle after every 24 days or maybe 25, and then all of a sudden you're getting it at 34 days, then 21, that's irregular. You should have that checked out, because you might want to see what's causing that. Now we have number 4, if when you're close to getting your menses, or maybe during when you're getting them, one, you're vomiting a lot, you're having constipation, or maybe you're having diarrhea, or maybe you're vomiting a lot, or maybe you are having those intense cramping, or maybe extreme pain during that period. That's very abnormal. Most of the time when you're close to getting your menses, there's something that we call prostaglandins that usually are produced to facilitate the contraction of the uterine wall, so that it's able to shake off the uterine lining, which is what now you're going to get out as blood, which will be now your period. Now if you've produced that, then that prostaglandin will leak to other areas, and then that's where you're now going to get those other issues, and especially your bowel. You're going to have a runny stomach most of the time when you have that overproduction. Now if you're getting spotting in between your cycle, or maybe you're spotting past your menopause, or you're spotting before you even start getting your menses, meaning that you are younger than before you get to now your puberty, that's abnormal. If for example you are past your menopause and you're spotting, you should have that checked out. It might be a cancer, but I'm not saying that that's a cancer. You have several other things that can cause that, so you really have to have your doctor check you out. If you are spotting in between your cycle, it might mean that either you are pregnant, or maybe there's something going on with your hormones that you need to have that checked out. Number 6, if you have missing periods, if you usually miss them maybe once or maybe several times, or maybe they go even for 3 months without coming back, that's not normal. You're supposed to receive them after every 28 days. If it so happens, it should be occasional, maybe you miss it or just only one, or maybe within some few days, you're not supposed to miss them more than 3 times. In case you have that, then you should see your gynae. And also in case you usually get the bleeding time when you're getting your menses, this is now from day 1 when you start getting that blood out. You are not supposed to go beyond 7 days. That will be excessive. It's not supposed to be that. So it's not supposed to be shorter than 3 days, or even beyond 7 days. So anything in between, very normal. Anything lower than that, abnormal. Anything beyond 7 days, then that's abnormal. Number 8 is abnormal discharge, and especially the one that usually come with the very weird bad smell. That one might be an infection. Now, if you're having a discharge prior, when you're almost getting to your menses, that one might be normal, and sometimes it can be brown or reddish in color. So this is due to oxidation of the heme that is already inside that red blood cells, because you see your vagina is acidic, so it might oxidize that blood. That's why it's going to be brown. And also you're going to have a discharge which is still normal immediately after you're done with your menses. So immediately before you get your menses and immediately after your menses. So after that, then you're not supposed to have any discharge unless maybe there's something going on. Maybe you are sexually aroused, or maybe there is something like an infection inside you. So you have, in case maybe it's an infection, you're not sexually aroused but you're having a discharge, see a doctor. If you are soaking your pad or your tampon in less than 1 hour, that one should be checked out, because that's your overbleeding. That might be a heavy menstruation. Now you might have also light menstruation, whereby you find that it's so like you just spot and it just goes. So that one is also something that should be checked out. It's not normal. And also if you are a teenager, you're past 16 years, you still have not received your menses, you should have everything checked out, and especially your hormones, so that they get to know thoroughly what's going on, because you're supposed to by that time to have started seeing your menses.